Good afternoon, everybody. Um, John, is everything posted? Is everything posted?
Apologize, my computer would not let me unmute. But I'm here now. Everything has been posted. I did receive confirmation from Las Vegas that our agenda has been posted live as well.
Wonderful. Can you call roll call, please?
I'm trying to get
Sure. Julie Weissman Steinbach.
Here.
Commander Davis is excused absent today. Saber McWhorter Clark.
I'm here.
Margaret Marcucci.
I'm here.
Linda Vejvoda is also excused absent today. Peter Whittingham.
I'm here. Good morning, afternoon.
Lisa Bonney.
I'm here. Thank you.
Obioma Officer.
I'm here.
Ashley Crow is excused absent today as well. Sheena Childers.
Here.
Lori Lutu.
Here.
And we do have quorum.
Wonderful. Do we have any guests interested in joining SILC?
So this is Dawn Lyons, and
Am I allowed to speak now?
Oh, is this who's speaking?
This is Sutter Rawlings.
Oh, you are here. Go ahead, Sutter.
Yes. I wasn't sure I was allowed to speak up yet. All right.
Yes,
My name
please
is...
introduce yourself.
All right. My name is Sutter Rawlings. I'm currently the legislative educator intern at Rural Centers for Independent
No, I'm
Living.
not going on there. I don't have any kids, any clients at
Erica Washington. Oh, thank you. I appreciate you muting. Go ahead, Sutter. Sorry about that.
No worries. And I also am a current member of the newly formed Youth Action Council, which is, I know, under the Statewide Independent Living Council. So I was curious about joining, and I believe having someone who is one, a member of the Youth Action Council, and two, a member of the youth, could be beneficial to the Statewide Independent Living Council. And I think being a part of the council could also be beneficial to me. So yeah.
That's wonderful. Dawn could get with you and go over the procedure. But welcome.
This is
Thank
Dawn Lyons. Thank you, Sutter. I will reach out to you. I have your email, so I'll be in touch. Thank you so much for expressing your interest. I know there was someone else. Her name is Kathy Gerby. I do not see her in attendance. I know she wanted to be, so it may be that she had a conflict, but hopefully if she shows up, I will let you know, Julie, so that she can introduce herself when she does.
Yeah, and there's always tomorrow. Okay. No other guests?
I guess I'm a guest. Am I considered a guest, Dawn?
Jackie, this is Dawn Lyons. What Julie means is if you're a guest at our meeting and you're interested in becoming a member of the council,
okay.
you can introduce yourself. That's all.
Okay.
Okay. Dawn, can you read the preamble to the public meeting? I mean, public comments.
Sure, it's the preamble to the public comment, right?
My brain had a fart.
Right, the preamble for the public comment. So no action may be taken upon a matter raised under public comment period unless the matter itself has been specifically included on an agenda as an action item. To provide public comment telephonically, dial 1-253-215-8782. When prompted to provide the meeting ID, enter 929-904-1434 and passcode 707401. Comments will be allowed at the beginning and end of each day and will be limited to 3 minutes per person. Persons making comments will be asked to begin by stating their name for the record and to spell their last name and to provide the secretary with written comments.
Okay. Does anyone have any public comment?
Hi, everyone. My name is Haiyan Bang, and I have a public comment.
Hi, Ann. I think Molly Rose Lewis had her hand up previously, and I just don't think Julie saw it yet.
No. I can't see everyone, so
You can go
sorry.
first. I don't mind.
Okay, so Haiyan or Molly? Which one, Julie?
Let's go with Molly.
Hey, hi folks. This is Molly Rose Lewis with Senator Jackie Rosen's office. I just wanted to say hello. I can't stay for the whole meeting, but I wanted to make sure that you know that I'm here. Also because I wanted to make sure you know that we are, of course, aware of the possible dissolution of the ACL, the Administration for Community Living, at the federal level. And we are doing our best to find out more information and figure out which things are going where. However, we would love it if you feel free to please reach out to our office as well directly if you're seeing that you can't get things done, that you don't know where to turn, that this, you know, or if you let us know where your programming is going, that you find out, or if just basically please keep in touch with us about it. We find out the news kind of at the same time usually that everyone else does, and then we just have to scramble to try to leverage our contacts that we have at the federal agencies to find out more, and figure that out. But we would love to know how things are affecting you and if we can help directly with a specific item and track it down, that kind of thing. So please just keep us posted. We are still here for everything else, casework related in terms of federal agency assistance, Social Security, Medicare, VA, etc. So please just keep us posted, keep in the loop, and I will listen as much as I can to as much of this meeting as possible. Thank you so much.
Thank you. Okay, and then Molly, and then Lisa.
You mean Haiyan? That was Molly.
Hi, sorry, folks. I clearly have to wake. Hi, and then Lisa.
Thank you, Julie. So, hi, everyone. My name again is Haiyan Bang. I'm the Outreach Youth Specialist for the council here. I would like to share what we have been doing. I just wanted to take a moment to share something important. We started a GoFundMe to support RCIL, which is run by Dee Dee Formaster. Dee Dee has given so much to our community over the years. She's been a strong advocate, a leader, and a friend to so many of us. Now it's our turn to support her. The funds we raise will go towards purchasing and maintaining a wheelchair-accessible van, supporting the weekly rec club, providing basic essentials and housing support, and helping with advocacy and outreach efforts. So today I'm asking each SILC council member to consider donating just $5. And even if you can't right now, simply share the link. That would make a huge difference. Thank you so much for your support. And I also included the link in the chat, but it seems like it's super long. So I'm gonna find the shorter link and I'll put it in there.
Thank you.
Thank you.
Lisa? Lisa?
It looks like she might be having trouble unmuting. Let's give her just a sec.
My apologies. Yes, I'm sticky. Lisa Bonney, Executive Director, Northern Nevada Center for Independent Living, for the record. I was just wondering, Molly, if you could let us know which office you're in. Are you here in Nevada? Are you in the senator's office in Washington?
If I'm allowed to speak, this is Molly Rose Lewis again. I know probably not on protocol, but I'm in the Reno office. And I cover, I'm so sorry, I'm eating. I'm eating lunch. I am the point person for the North. We have a point person in our Southern Nevada office as well. But I am also sort of the grants coordinator for the whole state. So feel free to reach out to me.
Perfect. Thank you.
Thanks.
Molly, could you put your contact info in the chat?
This is Dawn Liz. It looks like she already has put her email in the chat.
Okay, clearly. Any other public comment? I don't see any hands, but do you, Dawn?
I do not.
Okay. Moving right along. Does anyone have any corrections to the minutes from January? Does anyone want to make a motion to approve the minutes?
I'll make the motion. This is Margaret Marcucci. I'll make the motion that we approve the minutes as read.
Do I hear the second?
This is Sabra McWhorter Clark. I second.
I need to abstain this. I wasn't there. First, all in favor?
Aye.
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 Okay. Looks like, are there any objections? Motion carried. Okay. We already did introductions. So let's move on to number 5. And the first contact is Anne. Would you like to tell us what's going on with the youth action?
And did you get that?
Sorry, no, I got cut. I got cut off, and so I had to come back into this.
Yeah, sorry to put you on the spot right as you're just re-entering the room. You just happen to be the first one on the list of updates for our programs. So if you wouldn't mind just saying a few words, I know you submitted talking points for Youth Action Council news and updates. You could just maybe highlight a couple of those for people, and then if anyone has any questions.
Yes. Let me grab this note of meetings here. So as most of the member have knows that I just started back in January, the beginning of January. And so far, it's been going really well. We do have a few members. Our members are from Carson City and also Reno. And our first initiative that we decided to do as the Youth Action Council is the GoFundMe for our CIL, which was launched on Monday. So I hoped that to see that the council here do support, just to show the youth council members that, you know, they're working hard, and just showing them the support will probably encourage them some more. With that, our future goal is that we're looking to perhaps do a fundraiser, an annual, like a consistent, ongoing fundraiser for the council ourselves, because some of the members spoke about having an in-person meetup annual, because the members are from all over Nevada. It would be nice that we do have like an annual retreat or meetup for the council member. And then even some that are interested in going to the April Youth Steering Conference, where in our budget, we only have enough for one council member. But as our council grow, we would love to have funds of our own to send as many of them as they like to attend the, all these conferences across America. And we're continuing to recruit. So if any council member knows any youth with disabilities that would like to be part of our council, please reach out to me. And then we decided that every first and third Thursday, we will meet as a council over Zoom. Sorry, I'm so nervous, so I might be talking so fast.
No, you're doing great.
Thank you.
Hyatt's really doing a great job.
Thank you.
Yeah. Everyone should check out the council's Instagram. It's really good.
Thank you. Does anyone have any question for me?
This is Dawn Lyons. I don't have a question, but I wanted to let you know I spoke to a young man yesterday who sounds like he may be interested, and I will send you his email information.
Thank you.
Any questions? Okay. Let's move on to Mary. What's going on in this summer? No letters. Yeah.
Okay. Oh, yes. Good afternoon, everyone. For the record, this is Mary Eagle-Sizer. And then, Julie, I'm assuming we're on item number 5B,
Yep.
updates for Centers for Independent Living.
Yes.
Okay. All right. It's so good to see everybody again. Thank you for the time and the opportunity to present. I would like to share with everyone that last time when I reported, I was a little bit concerned because our numbers had dropped. However, this quarter, we had an increase in intakes of 58%, which is amazing. Now, I will tell you how we got an increase of 58%. We've been partnering with the Veterans Administration, and they have been inviting us to their homeless encampments. When we go to the homeless encampments, we take our information. We are blessed that we have some food coupons that we can give out and a bus ride. And so we help them as much as we can that day with the hopes that they will be able to get to the center or meet with us at one of our itinerant offices to continue to get services. Again, the leading service this time, last time it was about 45% service requests for housing. This time it increased to 65%. So with that, we know that we're still having a severe housing crisis, not just in Clark County, Nevada, throughout the state of Nevada. Also wanted to note that our transportation services did increase by about 5%.
I got it. You
And
want to
we
come watch
continue.
on the computer, you can.
Dee Dee, would you please mute yourself?
Yeah, sorry. I thought.
All righty. Okay, with that, I'm sorry I lost my train of thought. I will get it back. Okay, transportation had an increase. We continue to do a lot of work in helping individuals with disabilities with benefits analysis to see where they're at, what they have, guide them, provide them independent living skills training, peer support, and advocacy to get additional benefits such as Social Security benefits or veterans benefits, Medicaid, Medicare. So we are having an increase in that. Again, the disability community, yeah, one of the greatest needs is finances just to survive. So with that, it has been a banner quarter. We participated in 35 outreach presentations, and those included one of our favorites, the VA stand down. This was the second year at the World Market for the veterans, and they are starting to see that that's the location that we might, or they might use for a while at any rate. Also wanted to share with you that we are working with the City Council on the date for Disability Awareness Day. For those of you that don't know, that is the Center for Independent Living in Southern Nevada, Las Vegas. We cover all of Clark County. We have an annual event each year where we invite the community, specifically the disability community, to join us. We have entertainment, and we have vendors, and we have food. So mark your calendars for October 25th. Usually the City Council is able to give us the date that we ask for. If we don't get that date, I will let Dawn know, and she will let everybody else know, but we appreciate the council's participation. Also wanted to share with you that this Saturday we are involved in an outreach event at Valley High School. This is, for most of you that live in Clark County, it's the Star Fair that Clark County School District used to have for students with disabilities in the school system. And now they have it on a Saturday. They provide food, they provide door prizes, and the attendance just skyrocketed. The first year we had 556 parents and children attending. The second year it was over 500 parents and children attending. And they always include a vaccination clinic and vendors from the community that work with school to work transition students. And Hyan, I know you're new, but usually the youth council has a table there, which I'm assuming you've already got one. So we're hoping to see you there. We just saw you at the fair housing outreach this Saturday. So good to see you there. Okay, with that being said, I also wanted to share our PPR, our annual performance report for the Southern Nevada Center for Independent Living has been approved. We turned ours in last December. Then we got notice that Q90 was shut down. That's our database where we provide data. Then it was turned on again. And then they said, okay, one comment that we need to clarify with you and you're approved. So Don will get you a copy of that. And I'm glad we're staying with Q90. It's important that we have the right tools to work with our data. Now, next, I would also like to share with you that we are very appreciative of the grant that the SILC gave us. Don and I have been working hard getting all the paperwork Anyway, the ink dried to the paper. We've done our due diligence. Every I is dotted, every T is crossed. And right now we do have a job announcement. The job announcement for anyone that's interested is posted on our website, and it is under careers. So if you go www.sncil.org, and then if you click on the icon that says careers, the job is posted there. And we are, as we always do, we go through so many efforts to assure that an individual with a disability that can perform the essential functions of the job gets the job. So if anybody knows of somebody with a disability who has experience in housing, we're trying to make more connections for housing. We want to get more folks enrolled in our housing program. And so that's my report in a nutshell. I will share with you really quickly. The Southern Nevada Center for Independent Living, we know and understand what's going on with the current administration. And we have made it our goal. We have decided we're pushing forward regardless. We are moving on. We are not stopping any activities. We are getting calls from our disability community. Individuals are concerned, what do we do if you go away? So we're working on a plan A, plan B. Our plan A, we usually try to have a sustainability plan where we could refer our consumers in case of a crisis or an emergency. Right now, we don't know how to do that because we don't know who's here, who's not here, who's left, who's not left. But we're encouraging all other nonprofits to, number one, contact elected officials, let them know we're not going to take this sitting down. Number one. Number two, CILs are not here for the grant funds. We'll find a way to continue with or without the grant funds. We can't just walk away from the disability community when they need us the most, when other programs are shutting down. So with that spirit, we're moving on, and it's all clear as mud, but we carry on. So thank you very much for the opportunity to speak.
Thank you very Lisa. What's happening in the Northern Nevada CIF?
Hi, this is Lisa Bonney, once again, Executive Director from the Northern Nevada Center for Independent Living. I'm here to talk about, number one, to echo what my colleague Mary has to say about housing. I think every quarter we talk about the same thing, but housing is the number one service that we get asked for here in our office. And unfortunately, we have a lot of people seeking funds, which we don't have. We have a very small emergency fund to keep people in their housing that's subsidized by the city of Sparks. But aside from that, unfortunately, we do not have dollars. But we do know of some of the resources here in Northern Nevada that do, and we partner with Catholic Charities as well as the housing authorities to try and keep people from becoming unhoused. And that continues to be just a major part of our day every day. We have been very busy with our outreach throughout Northern Nevada. As you know, we service everything except for Las Vegas. Most recently, we had a team in Pahrump down there for their, I think they saw you, Don. I think you guys were back to back for their outreach efforts there, as well as we've been in Tonopah, Winnemucca, Elko. I'm sorry, not Elko, Winnemucca. We've been out in Ely and Carson City, and we have our regular classes that are going on through our center here. And then so I think that pretty much wraps it up. Are there any questions?
You got cut off like the last minute.
I'm
I
sorry.
don't think we heard everything.
I'm sorry. I'm getting this unstable internet
Yeah,
message. I'm so sorry. Let me.
that's okay.
Okay. All right. If anybody has any
Technology.
questions, I'm here to answer them.
Any questions for Lisa?
I don't see any hands raised, Julie.
Okay. Then let's move on to Dee, the Rural Center for Independent Living.
Hi, this is Dee Dee Formaster for the record. I'm from the Rural Center for Independent Living. And I have to say that this quarter, it's been housing, housing, housing. And they are still intermittently throwing people out into the streets who were on HUD housing and refurbishing their apartments and charging a higher level of money for apartments, which kind of is basically pricing our clients out of the market. We're seeing a increase, which is good, of vacant housing that no one will take because of the prices. And so that could be a good thing. It could mean that it will encourage housing prices to go down, or it could mean that they'll just stay up there and we just will have a harder time trying to find housing for our clients. I recently worked with a gentleman who is a veteran that's on HUD that needed to get HUD VASH, and our persistence has finally paid off after 9 months of him living in his truck. He finally got his HUD VASH voucher. So that was a win-win for both of us. And other than that, I have been attending the transportation meetings, the Board of Supervisor meetings recently this quarter, because again, they have passed a resolution to make homelessness a crime, and they are going to start arresting people who are laying or sleeping on benches or in parks, and they are going to throw them in jail and drag them through the criminal justice system and then release them back onto the streets because, of course, Carson City does not have a shelter except a 12-bed shelter, which is ridiculous for a population of 50,000 people. So I attended both hearings and told them that most of the people who were on the streets are people with disabilities and the elderly. They, of course, did not listen to a word I said or the other people who were there in attendance telling their stories. And they, of course, have criminalized it. Unfortunately, it passed. The good news is San Diego passed a resolution like this, and 9 months later they revoked it because it has caused the city to just about go broke, which I think is probably going to happen in Carson City because our budget money or my tax dollars are going to the jail as opposed to a nonprofit to provide services. So it's been a very annoying and hectic quarter. I have also been working with the transportation board. There's a meeting today at 3:45 that I have to attend. We are going to try to link up better with the Lyon County areas and hopefully get better services into the rural areas from our hub. Um, so I'm hopeful, or should I say, I am cautiously hopeful that things will move in the right direction. Um, Good news is that I now have Sutter, who has been working as our legislative educator. And we have been to the legislature. We have done a couple of tablings there already. We have worked with the community college, and I'm going to let Sutter talk a little bit about the things he's working towards.
Hello, Sutter Rawlings for the record. Um, we've been working quite hard. The first few days were kind of running on high, and then we're still coasting on that speed. But we've created brochures for our Center for Independent Living. We've also created a one-pager just to generally explain overall what a Center for Independent Living is to people and to spread that information around readily and in a very friendly and informative manner. And most recently, we were up at least myself, was up at legislature handing out these informative items to people for the rural college day at legislature. And I'm currently in contact with the Disability Services Support Office of the Western Nevada College. I myself am a student there, and I believe that the Centers for Independent Living that are located in Carson City, as well as I know that the Northern Nevada Center for Independent Living does have some contact, I don't know to what extent, with the colleges up there. And I would like to create something of the sort for the Western Nevada College and the Rural Center for Independent Living. So I'm trying to find some routes of communication and kind of strengthen some bonds and get the word out to people as much as I can.
So with the community colleges, we're hoping that we can get the student government to help us start a support group for people with disabilities in the college network also. So Sutter's been working very diligently, and we would be happy to share any materials that he has produced if you would like to see them. And other than that, I'll let Elko talk.
Hi, this is Margaret Marcucci. I am the Rural Center. I'm the Elko support staff. However, Don knows and Dee Dee knows I've actually been down for the count for almost 2.5 months. I'm hoping that's going to get better. Most of my clients, I have been talking to them on the phone, making sure they're okay. I've joined some of them at the state welfare office because Medicaid has cut a lot of their benefits and they are going nuts. And I understand this. Um, Housing's not so much around here. It's called transportation. I get phone calls all the time for they need to go places and stuff like that. And I tell them if I feel good, I will come and pick them up. I will take them. If they're my clients, I have a lot more that have come out. I'm also getting back in with organizations to make sure that they know we're here. By the way, I get to go see the van on Sunday because my friends decided that I need to go see it and see what it looks like so I can give everybody a report next time. That's about it.
Okay. Thank you. You've had your hand up for a while.
Julie, is that acknowledgement for me?
Yeah, please.
Oh, thanks. Dee Dee, this is a question for you, and I'm also inviting maybe Mary and Lisa to join in as well, as we understand a little bit more about the homelessness and the housing issue that affect our disability service population. Do we have any data to show whether or not our disability population affected by housing, is it how many related to maybe intellectual developmental disability versus physical disability, and perhaps maybe more importantly, whether or not there are other contributing factors maybe related to addiction of some sort that may be affecting the stability of being in a home or ability to afford being in a home because of employment. Do we have any data that would maybe address those issues?
I know that the statistic that of the 84% are people with disabilities and the elderly that are on the streets here in Nevada. I have to honestly say that I don't think anyone has exact numbers, but I do think that or alcohol and drug use within the disabled population may be just a secondary problem due to the fact that who wouldn't drink if you were living in the dirt? And who wouldn't use drugs if you were living in the dirt and you had no hope of having any kind of a life? So, like my husband says, I would be the first one at the counter to buy a beer if I was living face down in the dirt. So I think that that addiction thing maybe might be a secondary, as opposed to the initial thing that caused that person to go or end up on the streets is because they are disabled and they do not have enough money from disability to survive. When your rent is over the amount of, what is it, $986 a month, and housing here in Carson is going for a one bedroom, it's about 14 to 15 a month, which, really makes me think that it's easier to buy a house than it is to rent an apartment at this point, because you could certainly pay a mortgage with that much money. And so I think that the disability would be the first indicator. And what probably needs to happen is we need to work harder with partnerships with vocational rehabilitation to be able to get people placed part-time employment so that they can keep their existing housing. So that's my thoughts on the situation. As far as statistics, we probably have statistics through the centers, but that's about it. Anybody
Didi,
else have any suggestions?
Didi, I will wait to see whether or not Lisa or Mary add their comments, but the thoughts were to see whether or not these are additional factors that we can maybe leverage other resources that are maybe target specific to these other factors as opposed to only the resources that are immediately available to you from SILC. But I will yield to either Lisa or Mary whether they want to add any kind of comments to your response.
Mary, I see you.
Thank you, Julie. For the record, this is Mary Wilsizer. Peter, that's a good question. And Dee, I agree with what you're saying. Here in Clark County, we've noticed a trend in homelessness over the past few years. We're getting a higher percentage of individuals with mental health diagnosis. And the reason we're getting more consumers from that disability population is that a lot of the transition homes are shutting down. The county has transition homes, but they can only allow an individual to live there for so long while they try to get a job and try to get reestablished. So we're seeing an increase in that population. We are also seeing an increase in seniors that through no fault of their own, they're ending up in the homeless population. They did everything right, but with the rent increases that are coming, they can't afford the rent. And then with the amount of funds, like double the rent that you need to get into a new apartment, and with the shortage of housing. So that's a new population joining the homeless population. And the third population are young people. They don't make enough really to be able to live anywhere. They don't drink. They didn't do anything wrong. They just ended up where they are due to a series of unfortunate, circumstances in the economy. So then we also have the families. You'll have mom and dad working, but they're working part-time at a casino, no benefits. And those are the people that are homeless with their children. So homelessness has grown it's cutting socioeconomic status, like the seniors that once had money that don't have money, the college educated that can't get a good job or a job that pays them enough to get any place to live with the restrictions that we have. So it's an interesting question, Peter. I think the Gwin Association that we've had partnerships with getting data and statistics, and we'll be happy to put our data together. We collect that type of data for each and every individual that walks through our doors. We can tell you where they were before, what happened. We won't give their name or any identifying factors, but we take their story, listen to it. How did you get from point A to point B? And then try to help them to develop a plan to get out of that situation, not just with housing, budgeting, finance, you name it. We're involved in everything that it would take to help an individual develop a plan and achieve a plan for a successful life, to include housing, which right now we're facing brick walls because we don't have it. And one thing that I'd like to add that's very, very disconcerting. Yes, we have new housing complexes and we get excited and we tell our consumers, yes, the application's on the website, let's go do it. Well, we keep getting burned. We just had a new place open up, and we're trying to transition someone from a nursing home. And we were excited because they said they were going to have some units there for people with disabilities for $500 a month. When you're moving out of a nursing home, that's about what you can afford. Anyway, so digging deeper, they finally built the complex, they finally did everything. But now we went back and researched. They had one unit for 500 for an individual with disability, and that was their quota. And it was really, so we have been getting calls from our consumers saying, you did not tell us.
Now I have two on here.
So anyway, that's my input, Peter. But we'd be happy to put together our data for you. It's not in the millions, but it'll give you a good idea of a profile of what we're facing. And it's not your usual homeless person anymore. It is, that's part of it, but there's a new subculture in the homeless community.
Thanks, Mary. And we can talk offline, follow up discussion, and maybe the root of my question will be more immediate than in our offline conversation.
All righty, no problem. Thank you.
Okay, Joy.
Thank you. Now I have two, one comment and one other comment about something totally different. But based on this conversation, I also wanted to bring up the fact that I know I heard about some recent affordable housing that's being set up now in Southern Nevada for both senior population and youth coming out of the foster system. But I don't know exactly how much that is. And I think it's accessible space that it's providing that service. So I could reach out to them and see, they may possibly have that data. And I know that the CILs can only provide the data for the consumers that come into to get their services. So that's not everybody on the streets.
Yeah.
But it could be helpful information. But I think that's probably a really good thing to research and see if we can get more information on. And if you guys want, I can ask Accessible Space to come and present on their program and just to let us know what's going on with that. Or if it's not Accessible Space, find out exactly who that organization is, because I know I just read about it recently.
Yeah, I think that's a great idea.
I think it's a great idea, Dawn. I'm always up for more information.
Okay, and then the other question I had, this is from earlier when we were speaking in Elko about transportation. I wanted to know, I can't remember exactly where, and I was asking when I was at the Nye County Social Services fair, and they said it wasn't them, that they were providing services in that area. But was it Elko that rural RSVP no longer had funding to operate in? Was that what was going on up in Elko?
RSVP is still here.
Oh, okay, good.
But you have to be a client, and they're begging for drivers. They've been trying, because I've been trained on the van, how to put wheelchairs in and stuff like that. And they've asked me a couple of times to be a driver. And I said, my health does not warrant that. But she's been begging for people. And I know the lady who does it. And I try to recruit people so she can do it. We're going to keep our fingers crossed. RSVP is not going to leave. They just got a brand new 4-wheel drive van. Finally. Yeah.
Any other questions for Petey?
What was that? I'm sorry.
I was asking if there's any other questions for you.
Yes, is there any other questions for me? We have been just working hard with the homeless and doing everything we can to be able to provide the housing they need so that they don't end up on the streets. And it's a a constant battle. I'm sure that Mary and Lisa both feel the stress of trying to help our community to stop them from being homeless, just like I do. But it is an ongoing problem. I've started to talk to our Board of Supervisors about doing partnerships with complexes who have housing in the area to do this idea I have, which is to talk the apartment complexes into donating 10% or 20% would be even better of their apartment complexes. In return, the city could give them a property tax rebate. And so that's kind of what I've been pushing for in Carson City. I'm starting to approach that angle in the hopes that it'll work on a community basis. So we'll see. I'll keep you updated. But most of the low-income housing that is being built, just like Mary has found out, is not low-income housing, but what is called workers' housing, which means that low-income workers are eligible, but people on disabilities are not unless they are working. So we call it workforce housing. So I think that's a lot of what they're building now. So that's what I've experienced here in Carson anyway. So I'll shut up. Thank you.
Thank you guys for being in the trenches. Is Johnny here?
Yes, I am.
Okay, dear. Are you ready?
Certainly. Certainly. John Roseland, for the record, Aging Disability Services. We're giving an update regarding the assistive technology for independent living program that we have in the state. For those who don't know about the program or new to the Nevada SILC, so the assistive technology for independent living program has been around for a neighborhood of 30 years. Initiated through the Nevada SILC and the original Assistive Technology Act. Kind of all of the people with disabilities that started the independent living movement. And the program was designed around that concept of addressing those barriers and physical barriers with assistive technology, which could be modifications to the home, vehicle, and really just looking at like those essential daily living needs, right? The things that we have to do: bathe, be able to access our home, prepare a meal, essential things, like the things that you have to do every single day. The program is statewide. It operates through Care Chest of Nevada is now a statewide organization. Also does other things with our Assistive Technology Collaborative. But that's kind of it in a nutshell. Is we're here to address, to try to keep people living in their homes, removing those barriers that they would have to live in the community versus an institutional or nursing home. So I'll go through a little bit of the caseload statistics. What our caseload looks like. The report data I'm giving you is on the federal year. As you know, we do provide our report for, we do report, easy for me to say. We provide an annual report for the SILC that goes into your annual federal report because we record things in the same way that a Center for Independent Living does. That's the way this program was designed. is to develop those independent living goals or a waiver, either developing a plan or a waiver of a plan. It's just that our focus is, like essential daily living, and that can be solved with assistive technology, with the exception of transitioning from a care facility. We do have some different flexibilities there in what can be supported that may not be considered assistive technology. So the caseload as a whole, I'm reporting kind of like from that October, the beginning of your federal fiscal year, to as of the beginning of April. What the information I'll be talking about is about 210 consumer independent living agreements. What that kind of looks like is, on average, there's usually about at least 3 goals. It's actually 3.5 goals per person. So think of it in terms of you have a goal to improve your bathing, toileting, getting inside your home, and your personal transportation. Those could be 4 different goal areas. The average that we look at is probably about 3.5 goals per person. The caseload that we're looking at right now with that 210 consumers, there's a total of 742 independent living goals in those independent living plans. And because our services may last up to like 3 years, just for things to fall into place for somebody to accomplish their goal, to do the modification or move forward with something, we typically have that to deal with, as well as a wait list for funding. This is the first time in my 22 years, and I think in the 30 years of the program, that we don't actually have a wait list. In part, that's because of the ARPA funds, the Recovery Act funds that the state put towards these direct services. So we don't technically have a wait list right now. We just have a lack of vendors to get things done. So anyways, what that looks like, about 168 of those goals were met last year, or goals closed. 85% of them met in the prior year. This year, we've had 238 of those independent living goals met. 238 closed, 160 of those have been met. About 24% withdrawn, some due to no contact, due to people passing away. We have 335 goals open for those individuals. So those are all active independent living goals that we're looking at. 75 of the goals throughout these 210 cases were prioritized for the purpose of prevention or transition. Actually, there was only one of those was transition. The rest were identified as prevention-related goals. That's where, in a logical sense of looking at the issue there, if something happened and the individual went into a care facility or a rehab facility, went to the hospital, that would lead to institutionalization, right? Taking a fall, getting injured trying to access your bathing area, right? If logically that's going to end you up in a care facility that you would not come out of without a significant transition, that's where we would call that a prioritized goal. The reality is that if you had something like that happen and end up in a care facility and you weren't able to make your rent and you're in there for 30 days, 45 days, you're now a statistic that you're in a care facility. And as Mary pointed out on one of those, to transition somebody out and find that housing, again, that can take a year or two. May even take more if you're of lower income. So our services have always looked at prioritizing those prevention or transition goals. Goal types, just I try to do this every time. We have 3 main areas that are typically, I say historically, not typically, are the highest. Self-care. Self-care is more than half of all the goals that we address. So when I say self-care, we're talking about bathing, toileting, personal hygiene, preparing a meal, feeding yourself, those types of things. Secondary is transportation. That's personal transportation. That's looking at addressing making your existing transportation accessible or looking for an accessible type of vehicle. Believe me, we look through all of the options with the individual, and if public transportation is an option, that of course is something that could be the solution for the individual. But in most cases, we're working with people that don't have those options to access a public transportation, or it doesn't exist where they live. So they're looking at doing a modification to their transportation or find something that's already modified. 90 of the goals that we had, so that's the number 3 is tied to what we would call home access. On the federal level, it's called the community access goal, but home access, being able to get in and out of your home and throughout the home. If you're a mobility device user, having good doorways, hallways, those types of things, those are all barriers that can exist in your home. And not every home is built universally designed. So if you've acquired a disability later in life, your home may not meet your needs. And that's where we would address those things. So those are really the top 3. Number 4 is personal mobility. With our federal reporting stuff, if you're in the world of the Centers for Independent Living, they tie those 2 goals together, transportation, mobility. But I separate those 2 things out because it still is an important thing. 38 personal mobility goals, that's addressing. That could be somebody that is using and not able to obtain a white cane. One of the solutions I seen in there was the Meta glasses or something new that's come out that's going throughout. People with visual impairments are starting to use those in certain ways. So to address somebody's mobility and enable them to be able to get out and throughout the community, that's one of the solutions that might be in that area. Let me see, moving on. Call data. We really try to dissect what we have coming in with calls. And what I'm looking for when I'm looking at that data is, number 1, are we reaching consumers, the actual people that would be developing independent living goals? It's great to have neighbors and people that care for you, but they can't engage in an independent living goal for myself. So we want to make sure that we're getting that message out there that we want to talk to consumers. And really, I'm always pleased to be able to say, when I look at our call data and I see that over 90% of the people that are calling are like 74% are the actual consumer themselves, and 22% are people with authority to engage on the consumer's behalf, parents, things of that nature. That tells you good things, like our outreach is reaching the right people, right? We're not getting some third party person that doesn't have the authority to engage with the program. A high number of people, we have a lot of people that say that they want to develop independent living goals. I think we have about 50% of the callers that come in that actually carry through and develop that independent living goal. But that averages out to about 12 new consumers per month. Now to the brass tacks. Average cost of direct services. As a whole, again, we're looking at all of your essential daily living needs. And so 3 or 4 goals per person. That average cost is about $9,280 at this point. That's based on this year's expenditures, which equals about 1 month in a nursing home. The population that we're working with people with disabilities are low-income individuals, primarily under 200% of federal poverty. the reality is that if this was a Medicaid situation, if somebody went into a nursing home almost immediately, or within a number of months, this person would probably be engaging in trying to get resources, or that care facility would on their behalf through Medicaid. If we serve somebody and keep them out of a nursing home for 1 month, we are costing the cost of 1 month in a care facility, which is just crazy to me. Imagine how much money that is saving in Medicaid dollars, and that tying that back in to house supports for people with disabilities living in the community is much more important than that institutional care. When you're looking at the dollar figure is pretty significant. All right, moving on. Our consumer survey data. So every consumer that we serve, if at least one goal is met, we do 2 different types of surveys. We do one on the satisfaction of a goal being met, and they receive a copy of what goals they had developed, which ones were met, what all happened during that period, and there's a satisfaction for that. And then there's also a survey we sent out if the individual has withdrawn, and even if we can't get a hold of them, we still send them a survey and ask them questions. Do they find independent living a positive way of addressing that? Was there anything confusing about the process? We implemented that back in 2018. I think we've received 20 of those type of surveys back. Overwhelmingly, though, the data shows that people have responded that developing independent living goals are a positive way to move forward. I think we've had 1 person since 2018 that said it wasn't. The data also said, is there anything confusing about the process? Again, I think one person since 2018 said that it was confusing. We don't get a ton of responses in that area, but I think it does show that our process, the independent living process, is a good process in trying to help them identify what their true goal is, rather than a social services model of saying, well, we applied for a ramp. It's really about helping that person figure out what that independent living goal is about. Those open-ended questions, why are you trying to get in and out of your home? Where are you trying to go is a much bigger picture and much more important to try to solve. Back to the survey piece. The other part is the satisfaction. That's whenever at least one goal has been met. Survey results, we just have some good, always have good news as far as I'm concerned. Rating of the staff, 98% of the consumers put it down as excellent or very good. The amount of choice and control as a lot or quite a bit, 98% of the people respond positively. Overall satisfaction of the program itself, not just staff, 98% approval. Overall quality of life improvement, improved a lot or quite a bit, 98%. Overall independence related to the goals established, that improved a lot or quite a bit, 100% of the people responded positive. Staying out of a nursing home improved a lot or quite a bit, 88% noted that. 10% marked it as not applicable or did not reply. So that constitutes, there's your 98% right there. They didn't feel that their goals were in 10% thought that they weren't at risk of being in a nursing home, but 88 said there was an improvement. Ability to volunteer and access their community improved a lot or quite a bit. 72% of the respondents selected that. Percentage of use, the AT that they received, 89% used it daily, 11% weekly. There's 100%, so used at least weekly, 11%. Try to wrap this up so you guys can get going. I wouldn't say last time, couple meetings ago, comments to the surveys that were important, just hearing directly from the consumer. These are verbatim. I put these results in myself. So if there is a wonky way that it is written, that's how it was written. The comment as it is made is how I write it into the system. So don't think I'm misreading. It's just maybe the person that was writing it made a mistake. Here we go. One survey. I was pretty much housebound due to fears caused by my balance issues. The new lift has lightened those fears a great deal. Thank you. Getting this help to obtain an accessible vehicle was life-changing. I feel so blessed to have reliable transportation. Thank you. God bless you guys for everything you have done. I finally have my freedom back that I lost for 3.5 years. Thank you. Thanks. I can stay in my home. Thanks. You've changed my life for the better. This program has made a profound difference in my life. I can participate in my community and in my personal activities more fully and frequently. And the last one, the person put the modifications that were made to my home have made a huge difference in my life. I have Parkinson's disease and risk falling daily. Now I am able to, and thanks to the wonderful ramp and bathroom, get a shower. There was one survey that did have, I wouldn't say a negative comment, but it was confusing. The person put their name on the survey and they said, well, I asked for a chair. And so they had made a negative comment not a comment, but they had said that something wasn't helpful. We're following up with the consumer because they referenced trying to get a chair, but their independent living goal had nothing to really do with anything chair related. But we do report that we put that data in as it is received. If there is a change to that, we'll change those survey results and resurvey the person if there's something missed or address a new independent living goal. That's about it. I think I've went through everything from what the caseload looks like, the survey data and results. If there's any questions, please feel free to ask me. I will put my name and stuff in the chat as well. If after this, if there's any statistical information people want, please reach out to me directly. Thank you.
Thank you, John. Are there any questions for John? I guess not. Okay. We're going to take a 10-minute break. Is that correct, Todd?
Yes.
Okay. So it is now 2:18. So let's quick by 2:28-ish. Remind me who the next speaker is.
So we were in the middle of presentation and discussion, agenda number 5, and it references agenda item number 6, but I wasn't sure if you wanted to allow Jackie to present what the centers asked us to let them present last time before we move on to the next updates.
That seems to make sense. So let's go ahead and do that. So Jackie, you're up.
Hi, it's actually Lisa and Mary who will be presenting. I'm just managing the slideshow.
Okay, Jackie, let me know if you have any trouble pulling up the slideshow.
Let's see. Can you see that?
Yeah.
Okay. Mary, Lisa, you ready?
I am popping up the slides as we speak right now. All
Yes.
right. Okay. Thank you, Julie. Thank you, Jackie. Okay, for the record, again, this is Mary Eagle-Sizer. I'm the executive director for the Southern Nevada Center for Independent Living. And Lisa Bonney, my counterpart in Northern Nevada, she's the executive director for the Northern Nevada Center for Independent Living. We had been appropriated some funding that was COVID related, and it was towards the end of COVID. And we were racking our brains, to be honest. We wanted to do a project that would serve Nevada. We wanted to do a project that would be specific for individuals with disabilities, for emergency preparedness. And so we really gave this a lot of thought. What were the voids and gaps? And one day we were talking, and Lisa said, what about a disaster preparedness website specific for individuals with disabilities? At that point, we knew we had something. So we did take the initiative to get permission from our funding source to do this project. The funding was very confusing. It didn't give us exact clarity on what we were to do, but they did approve this project. So needless to say, now Nevada is one of the few states that has a disability specific emergency preparedness website. Be ready, nevada.org, and let's become our own first responders together. So Lisa and I are going to walk you through today about what some of the functions of this wonderful tool and resource for the disability community are. First of all, our goal with this website is to provide information to help people with disabilities and older adults protect themselves during public emergencies. We learned from COVID that we weren't ready. This is our Be Ready, Nevada.org. We want to provide the resources to help individuals with disabilities be ready. Let's become our own first responders. The disability community. Oh, excuse me, Lisa, you're talking on this one.
Don't
Sorry.
step on my toes. Hi, this is Lisa. As we were working on this project, like Mary said, you know, we wanted to do something that would be statewide. And the genesis of let's become our own first responders together comes from knowing that that within the first 72 hours of an emergency, a public emergency, let me rephrase that, a public emergency, experts tell us that we need to plan to be on our own. And so that's getting all of your resources together and knowing who your folks are. Can you go to the next slide, Jackie, please? Once again, this is the website. I encourage everyone to go to it at some point and poke around. It's really quite fun, if you can say that about emergencies. But we address earthquakes, rain or flooding events, heat waves, blizzards, fires, terrorism or shootings, and pandemics, just so that we can kind of set the stage for what types of emergencies. And then we want everybody to be prepared. And as people with disabilities or people who are older, we know that we require maybe some extra things in our day-to-day life, you know, maybe extra medications, things like that. So planning ahead, oops, sorry about that. Planning ahead is so important. Um, Experts, I'm sorry, I totally lost my train of thought. Go ahead and go to the next slide, Jackie. I'll catch up with you. This is how the site is searchable, and this is what I think is so cool. So you can select the type of emergency that you're wanting to prepare for or you want to learn about. And then there you go. So like there you can pick from the drop down. And then also the type of disability or disabilities that you have. And then that will sort through. You can submit from there. And then it'll give you overarching ideas. on how to be prepared, what to do, who to contact, those sorts of things, what you might want to be thinking about to have in your go bag. So, and then how to create your support network. And then let's go ahead and go on to the next slide, please. Mary, this is you.
Let's do this.
Alrighty. Go ahead, Jackie. We're going to listen to
We
Alice.
join a couple in their living room. Where would you meet?
Where we went on our first date. Tell him, Ron.
Park.
Seriously?
Here are 5 things everyone should include in their emergency plan.
People.
Identify your people and write down their information.
Make sure you have your important papers.
Have copies of your prescriptions and medicine packed in your go bag.
Know your plan and practice it.
And most importantly, make sure you've done everything you can to feel safe and be your own first responder.
BeReadyNV.org, brought to you by Northern Nevada Center for Independent Living and Southern Nevada Center for Independent Living.
Thank you, Alice and Rod. They summed it up. However, what we have on this website, it's a copy of a plan that you can print out. There's so many important things we don't think about. We don't think about meeting with household members, explaining to children, and work with them as a team to prepare them to deal with family emergencies. Children want to be involved. Discuss what to do about power outages, personal injuries, personal emergency telephone numbers, near telephones. Learn how to turn off the water, gas, and electricity. And here's an important one. Decide where to meet in case of an emergency, and decide what to do if you become separated. Choose a location outside your neighborhood in case you can't return home. Choose an out-of-town contact. Ask an out-of-town friend or relative to be your contact in the event of a disaster. Complete family communications plans. This should include family members. Don't forget school and work, and even load these numbers on your phone and help your children learn to do that as well. Plan escape routes from safe places in a fire or other emergency. You may need to evacuate quickly. Be ready to get out and fast, and be sure that everyone in your family knows the best escape routes out of your home as well as the safe places for your home in each type of disaster. And then draw a family escape plan, indicating 2 escape routes from each room. I wanted to read these. We don't think about emergency preparedness at all. We always say we're going to do it. So there, you heard it once. You heard it once. Ideas on what to do, and we hope that you can do it. Lisa?
And I think Jackie's showing us how you can download these forms and print them so that you've got everything that you need at your fingertips. I don't know about you, but this has been very helpful for my family. Let's see. So, and I think this is particularly terrific for our disability consumers. Assistive technology, medical and mobility devices, making certain that you've got your charge plugs, making sure that if you need extra batteries for any of your equipment, also medications, those sorts of things. Just be thinking ahead, because in the moment, we tend to forget a lot of things. The other thing is, it's not reflected here, but I want to say it while it's on my mind, is don't forget about your service animals and your pets, that you need to plan for what their needs are going to be as well as your own. And then let's listen to this.
We join a couple in their living room. What's in your emergency go bag?
Snacks.
Medicine.
Besides snacks, here are 5 things everyone should have in their emergency go bag.
A 3-day supply of food and water.
Ways to communicate and stay updated.
Like a cell phone charger, hand crank, battery operated radio, and batteries.
Medications.
Important documents.
And most importantly, make sure you've done everything you can to feel safe and be your own first responder.
BeReadyNV.org, brought to you by Northern Nevada Center for Independent Living and Southern Nevada Center for Independent Living.
So the question that they answered in some respects is what's in your bag. And if you go to the next page after this on the website, it's a downloadable form that you can start putting together that what do you need to have in your bag? Here are the recommended things that everybody should be thinking about. And then additional things to consider if you're a person with a disability or if you have special needs, all the different types of things that you might need to take with you. One of the things that I really encourage our consumers who are on oxygen to have available is understand what the settings are on your equipment. That's very important because in case you get separated from your equipment, it's very difficult to help you if we don't if the responders don't have that information. And it's really great if you can hand that to them and say, here's what my oxygen typically runs at. Those sorts of questions, those personal things that you need to know, that you might forget about in the excitement of a moment.
Okay, Jackie, are we ready for Who Are Your People video?
We join a couple in their living room. Who's your first call in an emergency?
Rod,
Alice, here are 5 important things to think about.
identify your people. These can be neighbors, coworkers, family, and friends.
And don't be afraid to ask for their help. Remember, you can help them as well.
Make sure they know your plan.
Have their information written down.
Share any important health information with them.
And most importantly, make sure you've done everything you can to feel safe and be your own first responder.
BeReadyNV.org, brought to you by Northern Nevada Center for Independent Living and Southern Nevada Center for Independent Living.
Thank you, Jackie. So who are your people? One of the important functions of obtaining a support group, is that you have people. What we're learning is that a lot of our consumers, individuals with disabilities, they don't have people. They live alone. A lot of them are seniors. They don't have outside connections. So we're trying to encourage them to build a network, to get to know new people. We like to encourage them to starting to identify individuals such as family members. A lot don't have family members, friends, neighbors. A lot of them will have their caregivers who are reliable and willing to help in an emergency. It's important to fill out the form. We have a form on the website with their names and contact information, and be able to communicate that you are also there to support them. That's important. A lot of times people forget that as a disability community, we have a lot to offer. We can be somebody else's network. We can be some part of somebody else's plan. Share emergency plans, communicate your emergency plans with your support network. Make sure they know where you will go, how to contact you, what kind of assistance you might need, and then learn the same information from them. Regularly update your plan. Give copies of important keys to people you trust, and show them where you keep your emergency supplies. All of these are important points we're not going to remember during the middle of a crisis. So the time is now. Okay, Lisa, do we want to talk about where do you live?
Yeah, the other part of this website that I think is so great is it's so searchable. And when we talked about a statewide initiative, we got concerned that people would have to ferret through a lot of information that didn't apply to them. And over the course of putting this together, we were able to talk to the emergency managers in every county in the state. And so all you have to do is go to where you live, pick a county, click on it, and it gives you all the information for your particular geography. And as you can see, there are all sorts of links here. These are kept, we do keep this current. We're in contact with everybody. And then this identifies, you have to remember that when there's an emergency, it's a public emergency is going to affect everyone. And that's, once again, that's why we say, be ready to be your own first responder, because everybody's going to be affected. But this helps you to get to the information that's in your particular geography right away, and give you the communication within that county right away. So this just makes it so much easier to be able to find information. And then we partner with the Red Cross to do programs to share this information. We've done a lot of them so far, but if by chance you have not had an opportunity or you would like to have one in your particular location, all you have to do is contact either one of the centers, and we will help you plan one, and we'll be there for you. Are there any?
Very good.
Go ahead, Mary.
All right. Thank you, Lisa. Very good. Now, at this point, we just want to remind you that there is a new resource. It's a tool for our disability community statewide. So it's standardized. If something does happen, we're going to do our best to keep it live. What that means is you will know what we know. And remember, though, during times of crisis, none of us knows a whole lot. So be prepared in advance. With that, we'd like to know if anyone has any questions.
It looks like Peter's got his hand up, Mary.
Yeah, yes, my hands are raised. I raised high. Lisa and Mary, and you may have stopped short of being specific on this particular point, but here's a scenario. I'm a loner, and I live alone. I'm visually impaired, and also I'm in a wheelchair. There is in order to evacuate, how would the police officer or fire department in my area know that I am one of those critical persons to have on their critical evacuation list?
Hey, Lisa, do you want me to take that?
If you don't mind, that'd be great, Mary.
Wonderful. Okay, Peter, you are alone and you live in a neighborhood. If you look around your neighborhood, you're going to have a fire department not far from you. Is that correct?
Yes, I'm just saying, wherever I am, how would the evacuation people know that I am unable to evacuate myself because of my disability, combined visual and physical disability?
Exactly. It's up to you to notify them that either the fire department or the police department, they are going to be busy during a crisis. So for you, because you have a wheelchair, and if you're, let's say you're someplace and it's a 2-story building, you need to have a plan. A lot of places right now do have a plan for wheelchairs, some of the university locations. So start looking for plans wherever you go. And then also, it's up to you to inform Peter. Like if you feel you're going to be in a situation, let's say you go to one of the downtown buildings, like the court records, and that is a 3-story building, but they have several different areas for wheelchairs to leave or exit during an emergency. So we have to take the responsibility, Peter, to start being our own first responder, and to letting people know that you need help. If there's a fire and you're in a building, and you're going to have to ask other people to help you. And so those are plans that if we keep them in the forefront of our mind, if we start looking for evacuation plans, if we start planning where we are, that for now, and then in your own neighborhood, reach out to, there's groups that you can reach out, the fire department, your local police department, and also if you have a neighborhood watch, those people are involved in their community and they want to be involved. As centers, we've been reaching out to a lot of the fire departments. A lot of them have already been trained what to do with a wheelchair, but we're trying to expose them to more situations. I hope I answered your question.
So just to let you know, to my knowledge, most major police departments and fire departments, they have a compiled list of critical needs within their jurisdiction that they target in terms of emergency, especially for evacuation. So you may want to maybe take another look at that and see whether or not disability persons in our disability community is included on their critical evacuation list. And it's true enough, yes, I have an immediate responsibility, but it's just a matter of practice that most major police departments, as part of their evacuation plan, they have created what they call a critical needs emergency evacuation list. And John Brown, who lives over there, who is a wheelchair, they would have known that, okay, as they're trying to evacuate, they would deploy resources to evacuate John Brown because they know that John Brown is wheelchair bound. So as you build the program, it may be something that you may want to consider to reach out to major police departments in the respective counties to see if they have their list and to make sure that they have people with disability also included on the list as well.
Exactly. And then from our point as a disability group and a disability community, we're educating our consumers to reach out because for the critical list, if you don't reach out and tell them you need to be on there, it's very difficult for our public first responders to know where to go. So, but thank you for that information. And Jackie, I think we had gotten more information on that. Would you mind speaking on that?
One concern, so we've worked very extensively with the Department of Emergency Management and Homeland Security for the state of Nevada. And yes, absolutely let the fire department know. They don't recommend promoting registries because their concern is that if people with a disability are on a list, sometimes they might think that they're done now. They're on a list and so they'll be fine and they don't have to do all these other things. But as Lisa said, in a public emergency like an earthquake or a blizzard, they still might not be able to get to you, even if you're on that list. And so it's really important for you to be able to have a plan and to take care of yourself for this first 72 hours. To answer your question, that's where it's really critical to have your network, your neighbors, your friends, your family, and so that they know that you might need assistance. Or that you may be able to assist them.
Thank you, Jackie.
Looks like Margaret Marcucci's got a question as well.
I do. I'm in a neighborhood that is a fire-prone neighborhood. And there are 95% of us that are seniors. They are disabled. The fire department, the NDF does have a list of people that would need almost immediate evacuation. Now, unfortunately, I'm on that list. Wasn't on that list. My other friend is on that list. We have a couple people that are deaf. We had one that's blind. So did you guys address that? The wildfires, especially in Eureka County, Elko County, we have them all over. I've been evacuated 4 or 5 times lately.
Yeah, so fire is on here. It was originally set up as wildfire. We changed it to just fire in general because the reality is if there's a fire in your neighborhood, it will affect everybody else in that neighborhood. So everything on here are things that will affect more than one person at a time. And so do you have information on fire, how to protect yourself ahead of time, how to be prepared for a fire, what to do in the event of a fire, and then what to do afterward.
And unfortunately, it's not just fire right now. There are other things going on that, people don't realize, especially in Elko County.
Like, I'm sorry.
Well, okay, we've had prowlers coming around and stuff like that.
Oh.
That's something that a lot of my people that I deal with, phone calls and stuff like that, even though it may not be in your thing, you kind of need to put something about, don't answer the phone calls, because there's people out there that will look at these lists and go, oh, wait a minute, I need to call you. You need to know this. And I won't tell you how many times I've had to tell people, no, please don't give them your information.
I will, we can mention that to Department of Emergency Management and have them integrate that into their planning as well. Thank you.
Thank you.
Any other questions?
We really appreciate your time on this, and we want you to share your thoughts with us, just like we just had. If you think of something or if you have a question, please just get in touch with either one of us, or you can get in touch with us through Dawn, and we would be happy to address your questions, or maybe add something new to the website itself. And just to circle back around, like Mary said, that the funding for this emergency preparedness information was through an ARPA grant for public health. Thank you.
It's really incredible what you guys have done.
Thanks, Julie. I really encourage people to get on and play around in it, because it's pretty powerful. There's a lot of information.
A lot.
Thank you for your time.
Yep.
You guys. Okay, now we're gonna go back to number 5D. And Dawn, would you like to speak to this?
Sure. This is Dawn Lyons. The updates and discussion regarding the Nevada State Rehab Council. I don't have a lot to share because I wasn't able to stay for the entire meeting last time, and the next meeting is May 6th. But they did go over some more of their reporting, as far as I know, and all that is on their website and available to see. I don't know if maybe someone else from Voc Rehab might have any other input to add, but I can give you a better update next time, because I'll probably be able to stay for the whole meeting on May 6th.
This is Sheena Childers for the record. I'm here with VR, and the only thing I would probably add to that, Dawn, is that we were able to, or the Rehab Council was able to publish their annual report by December 31st, and that is available on the vrnevada.nv.gov's website for anyone that is interested in looking at annually the performance statistics and some of the other work that the VR program is doing in the state. So that's the only other thing I would add. Thank you, Dawn.
Thank you, Sheena, for the specific information on that reporting that I was talking about.
You got it.
Okay. Next is aging and disability.
Good afternoon. This is Lori Lutu for the record. I just
Hi,
have a
Lori.
few. Hi, Julie. I just have a few updates. First, I would like to introduce Cecilia Alonso. She is our new regional coordinator. So some of you may remember Kelsey Meyer, who left, middle of last year. So it's taking us a minute, but we're excited to have Cecilia on board. Her region covers 5 counties up in northern Nevada. So her region covers Carson, Churchill, Douglas, Lyon, and Story counties. So her, along with Autumn and myself, make up the regional coordinator team for ADSD. So just please join me in welcoming Cecilia as she gets on board. This is day 7. It's her second week, so we're going to give her some time to get her bearings before we, begin to include her in all the things. So ADSD, we continue to follow what's happening with the legislative session, like so many of you guys. I think as of today, we have like 50 plus days left in session, so we're plugging right along. They are starting to do budget closings for state agencies. So currently, ADSD's scheduled dates for budget closings are April 25th and April 30th. From a budgetary perspective, ADSD did not get any enhancements, mostly just caseload growth by and large. Like has been mentioned here too, we're watching closely what's going on at the federal level and the changes that are occurring. And we don't really have any more information to share at this time, but we'll continue to keep a close eye on that. We just want to acknowledge, I know in this bill that there's an objective, it's 2.1.6, and it's for SILC to work with the ADSD regional coordinators to educate at least 5 rural medical facilities. And so we just wanted to make mention of that and definitely look forward to working and having future dialogue on that objective. And then I just wanted to highlight a couple of projects that we're working on. So one is a PCA workforce project. So we all know, not only in Nevada, but across the nation, the severe shortage of workforce for personal care attendants and similar fields supporting individuals with disabilities and older adults. And so in November of last year, we kicked off a PCA workforce project. And I just wanted to quickly highlight the 4 outcomes that we have attached to the project. And the first is to develop a consensus-based training curriculum. So with that, we would establish a standardized training program that ensures new PCAs meet all the regulatory requirements. The second is creating a workforce pipeline, so developing strategies to attract new individuals to the PCA profession, including scholarship opportunities. The third is enhancing provider and caregiver competencies, offering ongoing professional development programs for both the PCA providers and family caregivers, and facilitating career advancement, providing existing PCAs with opportunities to develop their skills and explore career pathways within healthcare. So it continues to develop. We do have a project manager. Autumn Blattman is the lead for ADSD overseeing that project. So we're just excited to see, where that goes and the efforts and the work that can be done in this space. One of the areas that I'm looking at is, and I know with some of the reports from the Centers for Independent Living, is food security. And so some of the challenges that our communities are facing with that. And I know on a previous meeting, the last one, there was some talk about feedback that some of the SILs are receiving and challenges with supporting individuals with food security. So I just wanted to invite anyone who wanted to talk further with me. I'm researching and trying to learn as much as I can, to please let me know if they would like to discuss further. I'd love to learn as much as I can. So that is about it for ADSD. Are there any questions?
I don't see any.
Thank you.
Thank you. Okay. Were there any conferences?
This is Dawn Lyons, and unfortunately, even though we were registered to go to SILC Congress, by the time we were able to confirm how many of us were able to go, the conference rooms at the hotel were already completely occupied. So they tried to get us to tried to convince us to be on standby, but since it was in Orlando, Florida, and it's so far away, we didn't really feel comfortable being on standby, not knowing if we would have a place to sleep for the nights while we were attending the conference. So we did not attend. I know Stephen Cohen did attend. I heard back from some of our National SILC people that he was able to speak with them, and I hope that he represented Nevada well. I'm sure he did. And I hope he enjoyed that conference. But Stephen, I'd like to invite you, if you have a minute, if you'd like to share a little bit about that conference, you can. I know it's kind of putting you on the spot. Are you here? Oh, he did say he would be in and out, and I don't see his name, so he must be involved with legislature right now. But when he comes back, maybe he can tell us a little about it later, or tomorrow, if he's able to. I could reach out to him as well and ask him so that he has a little heads up. But that was really the only conference that we had planned so far since the last meeting. The ones coming up, there is the NICL conference, which is the National Council for Independent Living, and that's going to be in July as usual in DC. I do plan on attending, and we may have room for someone else if they would like to go. So just reach out to me if you're interested. And then they did put out the announcement that they are accepting early bird registration now. So as soon as we can get those numbers in, the better, so that we can meet that early bird fee. And then Hyen and I will be going to or attending the Navigating the Road to Independence Summit. She's going to be attending the summit itself, and I'm going to be attending as a vendor. That way we can tag team on, she can learn all the information she can from that about what the programs offer for transition services and all that, so that she's more informed about that. And also I can help her recruit for the Youth Action Council and provide information about independent living. So that's what we'll be doing in 2 weeks. This weekend we are going to the Star Fair, as Mary was talking about earlier. So we'll have the chance to reach out to that population in Clark County anyway, about transition services and the Youth Action Council there. So we're excited about that. And then we're keeping our eyes open. I know we're planning on going to, I can't remember what it was. We just got an invitation to go to, I believe it's another homeless event in town. I'm not sure about that though. I'll provide that information next time after we've gone, and I can give you more information on that. But we've been getting invitations left and right. We did go to the Nye County Social Services Fair, and we've just been trying to do as much outreach as possible, both to educate people about independent living and the SILC and the Centers for Independent Living, and also to inform people about the Youth Action Council and try to recruit members for that council as well, and for those efforts. As Hyen has just been doing an amazing job as the new outreach specialist, and she's got all the social media down, and she's really on top of everything. So really excited about some new videos she's created for training for both the Youth Action Council and for new SILC members. And I don't know if you recall, but we've had offers from other organizations in the past to provide training videos for us, and they just never followed through. So it's really great that she's been able to accomplish that in such a short time that she's been with us so far. So we're all excited about that. And like I said, if you're interested in going to NICL, just reach out to me. That's it.
Any questions? Okay. Now, next is updates regarding the Department of Ed's Disability Innovation Fund.
So this is Dawn Lyons. I know Ashley couldn't be here. And to tell you the truth, Ashley had to resign because of all of her other duties, as she's been transferred in her duties to a totally other job position within the Department of Education. So she really doesn't have any direct hands-on with the Disability Innovation Fund's work anymore. So the only person that really is involved in that are, of course, Hyen and myself as advisory council members for the Nevada TRIP program, but also Jennifer Kane from the Department of Education, who is absolutely overwhelmed. And so I didn't have the time nor the heart to ask her today to give us an update, but we can do that next time for sure. We'll have something prepared.
Okay, great. And then we already did 6.
Sheena, you may have something to add to that since you have your hand up. Would you like to share?
I'm sorry, I didn't see it.
Yeah, the only thing that I would say is that I know in terms of an update on the TRIP project is that as of April 1st, the Nevada TRIP launched in the 3 pilot counties. So Carson, Humboldt, and White Pine. And so the website, the Nevada TRIP website is live for those pilot counties as of April 1st. And yeah, so that is the other update that I have about that. There is a postcard that I believe was sent to students and families that are identified as having some youth or children with disabilities across the state. So lovely little postcards have gone out. And folks should be seeing those as well. And I will put the TRIP website link into the chat as well. Thank you, Julie and Dawn.
Thank you so much, Sheena. That's really helpful.
Very exciting news. It's good to see something positive for change. Okay. Dawn, can you speak on SQ38, please?
Yeah, so agenda item number 7 is I'm guessing what you're talking about. Since we did do number 6 already, number 7 is for possible vote on council action anticipated for day 1 of SILC. So it's discussion and make recommendations regarding SB 78 proposal to eliminate the Nevada Commission for Persons who are deaf and hard of hearing. There's more to it than that, but that specifically I wanted to propose to the SILC, since unfortunately we could not foresee this as an issue, and have a position statement prepared in advance, that you allow me to speak on behalf of the SILC in support of maintaining the Deaf Commission's independence and their functionality as a commission on their own, because they struggled so hard to get that voice of their own, way back when they were a subcommittee of the CSPD, or the Commission on Services for Persons with Disabilities. I mean, it's been years they've been trying to get this voice of theirs heard and this opportunity to have their own, agenda and speak for themselves, their community. And so now that they finally do, now this bill would actually wrap them under, it would eliminate them and propose that their issues be wrapped under another organization of minority and health, and that's just doesn't really seem, it just seems too broad of a topic to provide the voice that the deaf community requires and that they've fought so hard for. So if you would allow me to, I would like to entertain a vote to give me the authority to speak on behalf of SILC in favor of the Deaf Commission's independence at the legislature at Day for the Deaf at legislature at the end of this month.
Do I hear a second?
I guess
This is Margaret Marcucci. I'll second it for you.
Okay, now any discussion?
Obioma, would you like to add anything to that, or can you offer any more specific information than I've given?
Okay. Hi, this is Obioma, officer for the record. So yes, maybe there could be part of what I missed that you were saying, because I had to run out to the restroom. So if you let me know. Forgive me for that. But with regard to you are correct with regard to what everything is being scheduled to discuss on that point there at the legislature. April 7th, we will have that Deaf Day where we're going to start from 8 a.m. until 4 p.m. and we are scheduling those people that are going to have sessions or sit downs with legislators. And in response, both to the Assembly as well as to the Senate, we are attending both the Assembly as well as the Senate. And we will be going on that day, and we will have town hall as well, also, and we'll be providing food. So we're looking to have those registered that will be going to attend for that event. Well, please do register for that is our request. And so I'm thinking I might have missed something else that you had said, though. Can you repeat?
Sure. This is Dawn Lyons. I'm sorry, Obioma. I didn't mean to put you on the spot. That's plenty of information more than I gave. I was just looking for details that I didn't provide. So that's very helpful. We had a motion and a second on the floor already, and now we're at discussion for, to allow me to speak on behalf of the SILC in support of the Deaf Commission at the day of for the deaf at the legislature. So it looks like we're just going to take a vote on it after this discussion. So thank you for providing that additional information.
Perfect. Thank you so very much for having the discussion on this. And as I'm planning to go, and you being willing to go there to support us, it's very appreciated. Thank you.
Any other discussion?
This is Dee Dee Formaster for the record. Obioma, I want you to know that I did email you and offer to volunteer Sutter and I to come and help you with anything you needed help with. Also, if we could set up a table, we would be much appreciative. Also, I wanted to say that time and time again, I don't know why the state cannot get it that we need to be independently heard. I don't think we need to be wrapped up with a lot of organizations. And it's very hard because when we get wrapped up with organizations, then we're often not listened to, we're often not heard, often it's harder to get things done. And they have worked very, very hard for their independence, and I think they should be allowed to keep it. So I would appreciate it, Dawn, if you would take the time to do this. And certainly, I will also come and speak on behalf of the deaf community in the rural areas also, because I think that this is a very important issue. Thank you.
Okay, and thank you so very much, Dee Dee. This is Obama Officer for the record. Thank you, Dee Dee. And also, with regard to SB 78, this is what you were talking about, correct? Yeah, okay.
Yes.
So yes. So I just doing some action on that. I having just heard about and listened in on this. So it seems that there's an amendment now that all the advisory board will be removing that bill, or removing that portion from the bill, correction from the interpreter. And there's a possibility of delaying that SB 78, or excuse me, delaying discussion till 2027 for that session. So that being said,
that's exciting.
Thank you, Julie. Yes. So that being said, the commission is going to go ahead and provide testimony. They have already provided testimony from a neutral testimony. And I want to thank all of you I want to thank all of them, excuse me, the interpreter needs to not me, the commissioner thanks all of them for consideration of removing that, and we'll be continuing to monitor this going forward. But I really want to let you know that yes, there was discussions very recently, and actually I believe it was Monday or Tuesday, just this past Monday or Tuesday, and where they have decided to go ahead and remove that through an amendment, and that's already been done. And so, and they've got that all. They're focusing on the license and the what's the word I'm looking for? The board and excuse me, the licensing and accrediting board council are now all of them on the board and the council, or several of them have got the board and the council have it under review right now. But the advisory board currently has removed that portion, or they have removed that from the amendment. And I beg forgiveness from the interpreter's standpoint for not completely tracking the language on this. Wasn't quite prepared for this component, but thank you for putting up for the interpretation as well, Obiama.
No,
So this is Dawn Lyons. Thank you, Obioma, for the update. I was not aware of that, obviously, but now I guess my question is it still needed for the SILC to come up and support the Deaf Commission? Since it's been removed from that bill, is that a sure thing that it's been I mean, it sounds like it's been totally removed, that you will maintain your independence as a commission. So I didn't know if you still needed the SILC to come up and provide formal testimony on our support for that.
Okay. So to my understanding with regard to this discussion, this is Obiama for the record. My understanding we're talking about with regard to Deaf Day at the legislature, that is an event that's being hosted by the commission for the community. It's a Deaf Awareness Day for the legislature. And that, with regard to SB 78 bill, is a separate discussion from the Deaf Day at the legislature. Those are two different things. So what that means is if you wanted to go for the Deaf Day, for the Deaf Awareness Day, to give your support as showing how SILC is there and having a discussion about the bill, et cetera, there are several bills that we are giving support to now and are showing and discussing and helping them to understand as part of the community. With regard to SB 78 specifically, that's a separate discussion entirely. And so if you wanted to show up for that particular meeting and give a neutral or support or an opposition to that, that is entirely up to SILC and what SILC wants to do. But I would definitely encourage you to go to Deaf Day. That would be wonderful, the Deaf Awareness Day.
Okay, so this is Dawn Lyons, and I'm going to go ahead and amend my the motion that I'm asking for then. I guess I'm going to ask the SILC to support me representing SILC still, but totally disregard SB 78 support or SB 78 issue, and that I just go to support the Deaf Commission on that day on behalf of the SILC.
Ms. Obiama, for the record, thank you so much for all the clarity. And yes, we have a registration, and it's those who are coming for that day, or we need to register, rather. We have to register. Those, not me, but those of you who want to attend have to register. And I will be there as a vendor. We'll have vendors there as well. Excuse me. We'll have vendors there as well. And that also have to register. they have to register as vendors and fill out their forms. So for the purpose of having their exhibits and tables and everything set up, they have to register. So yes, please do. That would be wonderful. We'd love to see you there. And thank you for all that you're doing to collaborate and work with the Deaf Commission. And being an ally for the deaf community.
Is there any other quick discussion before I call the vote? Okay. All in favor? Aye.
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 Any objection?
Aye.
Any objections? Motion passes.
Thank you again.
Okay. Then thank you for the good news. We really needed these days. Well, because we're doing so well, we're gonna go on to item 8. And then we'll have public comment after that. So, for the sake of time, Dawn, could you speak to this?
Yeah, so this is Dawn Lyons, and before we jump into this, let me apologize for me confusing you about the last agenda item because it says nowhere on there about day at the legislature. So yeah, that was all on me, just confusing the issues. So I apologize for that. But anyway, number 8 is discussion regarding the SILC executive team and chair's responses to the Texas versus Becerra case against Section 504 of the Rehabilitation Act and how Medicaid cuts disproportionately hurt people with disabilities. And those are 2 separate issues that I put into the one agenda item because really there are things that just came up recently for the disability community that I felt that the SILC might really have a high interest in discussing. I included some materials about those specific items. I can pull them up and read them if you'd like me to, or if you want to start that discussion. You know, I don't know if you're aware of what our national organizations have been doing together as a team that includes April, Nickel, and National Silk. But they have been getting together and really doing some systems advocacy in the background as far as, you know, I've forwarded information on how to contact your Congress representative and tell that, and Nickel has provided verbiage for people to submit to them in support of, you know, Medicaid, not doing Medicaid cuts. And in support of, or in opposition to the case against Section 504 and how that could negatively impact people with disabilities. And so I know that Julie, you've written some personal letters yourself, and I didn't know if anybody else had or if they had anything to share in that regard, but I just wanted to make sure that the SILC had an opportunity to discuss those important issues. So that's what's on the agenda.
And I just wanted to give us some space to, it's a lot to take in. I feel like every time I look at the news, there's another attack on our community. And I really appreciate being part of Nevada Silk just for the community report. Does anyone else have any comments?
This is Dee Dee Formaster for the record. There will be Medicaid cuts, I'm sure, and it will be devastating to our rural communities. And I'm hopeful that somehow the legislature might be able to put some kind of a Band-Aid on it, but probably the first to go are going to be single males and single females without children. That's the way it was back in the 80s. And unfortunately, what will happen is that will create an unhealthier generation coming up, which may mean more disabilities. Thank you.
Margaret.
Thank you, Julie. I know that the cuts are already happening, unfortunately. I've had calls to go in with people to find out why. A lot of it has to do with food stamps. There was also something that came from the legislature. I don't remember. I apologize. That said that they were going to possibly make people on welfare or on Medicaid get jobs and be able to do that. That was one of the fixes to the situation.
This is
That's
sorry.
Have you heard that, Dawn?
This is Dawn Lyons. I just wanted to add also that I did, through Julie's request, I asked Nevada Medicaid to present to us and discuss more about this with us and give us a better idea of what that looks like. And they said they didn't have time, but they did give us their PowerPoint from the presentation that they provided at, I believe it was at legislature. So I did include that as a meeting material. I don't know how much sense we can make of it without anyone explaining all the slides to us, but maybe if you guys could write a list of questions and send them to me, I can submit that to Medicaid and they could respond when they do have time. And then I could share that with the group or post it on our website so that all can see those answers to the questions that we have. That might be a good way to approach that since they didn't have time to present to us.
Does anyone else?
Does everyone think that's a good idea to read over that PowerPoint that they provided to us? And if you have questions as you're going through it, to send those questions to me in that regard, and then I can compile that and send it to Medicaid?
Dawn, this is Sabra McWhorter Clark for the record. I think that's a great idea.
Okay, thanks.
That way we can review and provide the info to you.
Yeah, and I would encourage even the public, you don't have to be a SILC member to ask a question. So, I can put my email in the chat, and if you have a question that you would like answered by Medicaid, I can submit that to them.
I think it's a good idea.
So, and I don't have an update on the lawsuit. I don't even know necessarily when when they're going to be heard next, or where they're at on that in that regard. I haven't heard any updates yet. Usually we get updates from our national partners, and I haven't heard anything more on it yet. But I know that a lot of us have submitted our dismay to our representatives about that, and expressed our concerns. So I appreciate everyone who has done that. I thank you, because that's so important to do that on an individual level, and to just really inundate our lawmakers to let them know that we disagree on a personal level.
Oh, wow. Okay. Well, you're seeing one hit. I think I'm gonna ask Dawn to read the preamble to the public comment.
Okay, I guess it's public comment time. No action may be taken upon a matter raised under public comment period unless the matter itself has been specifically included on an agenda as an action item. To provide public comment telephonically, dial 1-253-215-8782. When prompted to provide the meeting ID, enter 929-904-1434 and passcode 707401. Comments will be allowed at the beginning and end of each day and will be limited to 3 minutes per person. Persons making comments will be asked to begin by stating their name for the record and to spell their last name and provide the secretary with written comments.
The name of the comment.
Bioma has her hand up.
Okay,
Okay. Yes. Hello. This is Obiama for the record. Obiama officer. I want to thank all of you for your persistent allyship and support of the deaf and hard of hearing communities. As I recently commented, or I put it in the chat about the agenda. We were talking about Deaf Day at the legislature, so I want to announce formally that you are invited as SILC members to participate on April 27th, 28th. On April 28th. It will start at 8 in the morning, and we will have a light snack for breakfast, refreshments, and then we will have a lunch as well, provided for those who register beforehand for the event. We will have a full array of vendors for the event. The vendor fair. So there will be a vendor fair during this event. And if you're interested, please register to participate in that as well. This will be open to the public to attend. It will be part of the day, and we will have a variety of voters and legislators who will be interacting there. So it's a good chance to show your support of the deaf and hard of hearing communities and what resources are available. Okay, thank you very much. That's the end of my comment.
any other public comment? . 。 I don't see any hands.
I don't see any either, Julie.
So, so that means I get to adjourn the meeting. I think that's what it means. So, meeting adjourned, and we will see everyone tomorrow. Thank you for this really productive and efficient meeting. You guys rock.